are Gail. Gail, uh, Gail is our board of trustee for HIMAP, and I'd like to turn it over for Gail to open the session.
Hi, good afternoon, everyone, and welcome to the 10th virtual membership meeting with members and friends of HIMAP. Today, we will talk about how to ensure the health and safety of our employees in the workplace under the new normal. Now that we are already at 15,754 cases as of yesterday and almost 13,000 in the first week of July alone, this topic is very timely. July 8th, Wednesday, we saw the highest number of cases at 2,539. And now that we are on GCQ and public utility transportation is now available, today actually marking the first day that back riding and motorcycle has been allowed, it is timely for us to make certain that our employees are safe in the workplace while practicing the minimum safety precautionary measures under the new normal. Some of the questions that will be answered today will be focused on our employees and their safety, such as what do we need to do if one of our staff members is found to be COVID positive? Are rapid tests required? What is the current trend in the industry? If you want answers to these questions, then you're at the right place at the right time. Please stay tuned as we reveal the answers to your questions. Today, we will have two guest speakers, JL Bator and Mac Aidinan. We also have two panelists, Michael Chu Lim and June Saa, with Vincent Remo as our moderator. I would also like to acknowledge everyone here today, the HIMAP Board of Trustees, our Secretariat, our friends from government, our association partner, IBPAP, as well as Willie Tanagon of the Quezon City ICT Council. And of course, I would like to acknowledge you, our dear HIMAP members, partners, and friends for attending today's virtual membership meeting. Thank you. So the next step is for me to introduce our moderator for today, Vince Remo, VP and Board of Trustee of HIMAP. He is also the Director, Vice President, Innovation and Development for Advanced World Solutions Incorporated. Vince has over 26 years of experience in the IT industry, a software R&D practitioner with a track record of implementing as well as managing successful projects for the Japan market. He was also in charge of starting up their branch office in Western Japan, where he served as a general manager for almost 5 years. He is a member of the board of directors in Advanced Roads and Advanced Road Solutions Incorporated, and concurrently serves as the vice president for solutions development for both companies. Welcome, our moderator, our VP for HIMAP, Mr. Vincent Remo.
Hey, good afternoon. Good afternoon, everyone, and welcome to our 10th webinar. No, 10th ito, no? This is the 10th one, and I'm very, very excited because the ECQ and the GCQ never hindered us from being able to share information among our members and together with our partners from government, other industry associations, as well as the public in general, as to what to expect during these times. So today our topic really is more on how do we transition from our current GCQ or MGCQ, wherever you may be, I mean, and into the new normal. So the new normal, how is it defined? What are the parameters in saying that we are already in the new normal? And how do we transition from the current situation to the new normal? Meaning, as we open up our businesses, as in the Philippines itself, as it opens the economy, how are we going to adapt? How are we going to manage this transition? So those are the topics that would be discussed today. It was mentioned by Gail that there'd be two speakers and two panelists. So I will introduce them one by one later on. So our economy, as it grows and as we open it up, the main concern perhaps of most of us, of most of our companies, would be how do we protect our employees? How do we protect our business? Well, we protect our employees to protect our business. So when we protect our employees, we also protect the interest of everyone else, not only in our company, in our building itself, and in our country as well. So what would be the adjustments that we need to make in order to make this as smooth as possible, this transition as smooth as possible, would be the key points, I guess, of the topics that will be discussed today. So I guess without further ado, I would now like to introduce our speakers. But first, I'll introduce them one by one. I'll do it this way. I'll introduce the first speaker, allow him to do his presentation, and then introduce the next speaker. That's how it's going to be. And then if you have questions, during the presentation, I would encourage you to type them in our chat box here in the call itself, so that I would read one by one, and I will ask the questions, and I can get the answers from our speakers. And also, what else? Yeah, as a reminder, yeah, we can also have the Q&A session after the speakers and after the reactions from the panelists are done. And then it's gonna be a 1 to 1.5 hour session. So please bear with us, and hopefully you will learn a lot from this session. So without further ado, let me introduce you to our first speaker. Okay, let me just pull up the file for our first speaker. Our first speaker is the Business Development Manager and Product Manager for iPatient Care and Health Systems at Point West Innovations Corporation. His name is JL Botor. JL is actually an experienced BPO operations practitioner and business development and sales manager with over 17 years of experience in the healthcare information management BPO space. JL's core proficiency also includes product conceptualization and development, product rollout, market study, and research. JL has been an active mover in the local healthcare outsourcing industry and has served as past president and board member of the Healthcare Information Management Association of the Philippines. JL is currently the Business Development Manager for Healthcare and Product Manager for iPatient Care PH Healthcare Systems at Point West Innovations Corporation, one of the top and the largest Filipino-owned IT BPO company in the Philippines, serving global clients. Ladies and gentlemen, Mr. JL Botor.
Hi, good afternoon to everyone, and I hope you're all safe. Kindly acknowledge if you can hear me all right.
Yes, I think we're good, JL.
Yes. Thank you. So I'll start my presentation by pulling on the slides. Okay, so basically our title for our session or our webinar on the topic on ensuring employee health and safety in the workplace under the new normal would go around the very main topic of the COVID-19. And as we discuss that, we're going to see how companies are adapting. And out of these adoptions, we're going to see what best strategy can be learned from the different sharing of experiences. And especially also the own experience of Point West will be shared on how we also adapted not just on policies, but also in adapting to some technology that helped us a lot in ensuring, of course, the employee health and safety in the workplace. So my topic on the next slide would basically, the talking points would be an overview of COVID situation in the Philippines, looking at the illness from the mild, moderate, and severe, and then also do a very quick discussion on how businesses were affected, and then the phases of COVID-19, looking at how businesses adapted to it, and especially focusing on the BPO sector, and then of course the reopening of the business, which I have tagged here. It's really a complete overhaul of the current systems, and then there's that question to test or not to test, and then later on we will have a very quick discussion on what strategies do the company need to employ in order to protect our employees? And what do we do if there are cases among our employees? And then lastly, let's talk about available technologies right now that may somehow help us in dealing with the new normal and ensuring, of course, the health and safety of the workplace. Now, let's look at first the situation right now. In the next slide, you would see the current updated tally as of July 10, 2020. So you will see that we are now over 12 million all over the world. And of course, the United States remains to be the top notcher. And if you take a look at the countries that we have been looking at, how they exponentially grew over time. One is India. I think we're the first one to have the cases, but it's only, I think, India started probably late March, but they have overtook a lot of countries. And then we also look at Canada and how they are faring, being in proximity to the United States and the difference in the strategy. And then, of course, Indonesia, being twice the number compared to the Philippines, they also exhibited a lot of the numbers. And of course, Philippines, as mentioned by Roger a while ago, the tally right now is 51,000 cases with over 1,314 deaths. And of course, as he mentioned also, it seems that the active cases is very disproportionate to the performances of other countries. Now, this is the scenario in the world. And we have seen that even if it seems to be that the Philippines has a acceptable number compared to the other countries, still, this is something that we cannot simply ignore. This pandemic has caused a lot of damage in both the health and also businesses in the Philippines. And in the next slide, you will see how exactly the Philippines have been affected by COVID-19. If you take a look at the slide, you would see that BGC streets void of cars and people. And probably the only time that I may say that this happened was sometime when we have the Holy Week, where people really are on vacation. But it's very surprising, even on the cars side, that a lot of people really obeyed government and stayed at home. But what is staggering is the fact that we have seen losses in both jobs and in revenues as far as these businesses are concerned. And let us look at the next slide. And we will see that these are the phases of the Philippine epidemic response. So the early stage happened late January, February, March, which is basically 2 months. And we have seen 3 imported cases. And then there was really a big effort from government to do the contact tracing and containment. And the number 2, March 6 to March 15, about 10 days, we have seen the initial surge of cases. So we have seen acute cases rise in Metro Manila, and then there was a community spread. And this is evident by the fact that we have seen even in television, ERs complaining about being overwhelmed. And then came the March 16 lockdown, which is the community, the ECQ, which put everyone in their homes. So there would be the ECQ provided the healthcare system in the country to be able to build the capacity. And it was also where we have found out that our healthcare system cannot sustain really a big influx of patients. There was shortage of PPEs, there were doctors being infected, there are health workers also having some problems in reporting to the hospitals. And this is also where we have seen the public-private partnership, where private sector volunteered their hotels, volunteered their places to become quarantine sites, etc. And then come now the general community quarantine, which is basically starting from June and to the present. And now we are faced on the dilemma of being asked to return to work, but accepting the new normal. Now on the next slide, I'd like us to see this borrowed slide from Ray Untal. He presented this during the DTI forum in the United States. And you'll see here that as you look at the timeline, March 16, there was the ECQ, but BPO sector remained productive by virtue of the work from home arrangements. So DTI helped us by allowing transportation to still continue, shuttle services, and also allowing the transfer of computer sets from the office into the homes of the employees. And then came April 7, it was the first extension of the ACQ until end of April. And we have seen several memorandum circulars issued by DTI helping, of course, the BPO sector to still continue operation. And even when there was a second extension of the ECQ of May 15, 2020, you have seen here that the productivity of the BPO sector remained at 75%. Now, there was a reclassification done in May 16, and we have seen now how PESA work also with such memorandum circulars, allowing us also to still continue our operations, with some now being allowed to go back to the office premises with certain conditions. And in June, we have seen that Metro Manila was placed under general community quarantine. We have seen a lot of workforce going back to the office premises, and the productivity rate, as estimated, grew to 85%. So this is a good timeline that basically tells us that among the different sectors, we have seen BPO to still was able to hurdle all of the limitations of the lockdown. Now, on the next slide, I borrowed this also from USEC Seferino Rodolfo. It tells basically that during the enhanced community quarantine, what is very good is that even if that a lot of businesses were hampered from operations, exporters and BPO, especially those providing on-site accommodation or work-from-home arrangement, provided that differentiator from any other industries. And then on the next slide, you will see that the messaging of what the Philippine government did is that there was really a preparation done from the onset. And then when we hit the announcement of being in a GCQ or ECQ, I mean, we already have the BPO sector, even if there was really a very short notice, able to allow the employees to set up workstations and basically allow the work from home setup to happen. So in the last line, you would see that there was really an increased demand for IT services. And probably this is also because with the pandemic, there's also that demand for solutions, for contact tracing, solution for data gathering, analytics. So a lot of IT companies were tapped by government, from DICT to DOH, from AITF, just to be able to come up with a good reporting tool, a good way to gather data and allow now government to work on models in order to create additional programs and projects that will help the country fight COVID. Now, on the next slide, you would see that as the business reopened, there's really a need to do a complete overhaul. So I have gathered several memorandum directives and resolutions from both from DOLE, PESA, DOH, EITF, even local government units. And they really pointed out several strategies on the return to work arrangement. But I have listed at least 11 that I think most of you already are familiar with. But let me just highlight that the pandemic opened up, even for government, the requirement to do meetings virtually. And then that basically gave birth to our webinars in HIMAP. And then the work from home arrangement became popular. And then they also allow the flexible working hours or the rotation of shifts in order to basically minimize people in the offices. And then lesser employees in the offices allows also that social distancing. Then government also required companies to do faster transaction to reduce the stay of customers and reduce now the interactions. And they also defer mass gatherings. Now there's also a need to do workstation distancing. I think companies are already adapting that. And then add markings to facilitate queuing, and then even office navigation. If you go into the floors of a production facility, there's basically a traffic scheme that they created, one-way traffic from going in and then going out, to allow also people from distancing themselves when they are working, and then provide transport or shuttle services and provide near the office accommodations. Now, the basic requirement is of course self-care and sanitation. That's why wearing of the face mask become a mandatory. Some also use face shields, and then of course the frequent washing and disinfection. So if you gather all of these practices and put it in the office practice, basically we are accomplishing more than 80% of the precautions for COVID. Now, for business for the next slide, you would see that for the health requirements, some of the things that are done by the private sector and the government offices redound to the at least 6 documented things that they did. One is medical checkup that allows the employee to obtain a fit to work medical certificate. They're doing that. Even if you're traveling to the provinces, the LGU would require that you present a medical certificate. But you know how problematic the process is, lining up, of course, in the clinic. COVID testing, they're doing that, especially on the rapid test. And you know how expensive that was. And then, of course, we have also the 14-day symptom-based testing. I'll dwell on that in the next slide. Then we have the health surveys, allowing the employees to answer health questionnaires. And then, of course, we have intensive contact tracing. And then there are other company-based initiatives, like adapting some sort of technology. I've seen a lot of companies adapting health questionnaire done by Google Health Forms, a Google Forms survey. And we have also some apps that basically is really more on the contact tracing, like Stay Safe, EndCov, WeTrace, Clear, Tanod COVID, CovCT, and even Apple and Google came up with their own contact tracing app. Now, as I mentioned, the RT-PCR test or antibody test, basically 2 types of tests, but these are basically in the range of, for the PCR, it's in the range of 7,000 to 11,000. That includes the administration of the doctor and, of course, the laboratory. And then for the RT-PCR, for the antibody testing, it would range from 1,000 to 1,500. The minimum order for that one would be at least 25 orders. So some companies opt to this, but I think this would be the most expensive option. So the next slide, you would see that while there is an option to do testing, there's also an option to do a daily symptom checklist. So I adapted this slide from the slide of Dr. Manuel Dayrit, presented in the Ayala Enterprise Circle e-forum, that basically lists down the different COVID symptoms, and he indicated percents of patients who possess those symptoms. And if you take a look at the hierarchy, if you only have vomiting, diarrhea, it's not a cause of concern. But if you go into the higher ups, which basically fever, sinus pain, cough, altered sense of smell, there's a big possibility of you contracted COVID, because these are precisely the main symptoms of the disease. So on the next slide, you would also see that if you do the 14-day symptom-based test, there's only 2 questions that you need to ask. One question is, have you been exposed through contact with known COVID case or traveled from areas with community transmission in the past 14 days? So for the first question, you're basically looking at 2, exposure, and the other one is travel. And then for question number 2, have you had any symptoms of influenza-like illness for the past 14 days? And that basically are the fever, headache, cough, and cold. And we're now talking of the symptom. So for the 2 questions, a yes to either question means there's a possibility of a positive test, and a no to both questions would yield you a negative test. So you can do some exercise similar to this one, but you can also incorporate this in an algorithm in allowing you to automate the finding out the results. Now on the next slide, there are several scenarios where submission of the fit to work clearance is required. For example, if you are an employee who did not experience any symptoms in the last 14 days, then basically you do not have to get a fit to work clearance. That can be a policy for a company. Now, if you are an employee with COVID-related symptoms in the last 14 days, then you need to have a clearance. Then if you are an employee who had exposure, then you have to have clearance. So you can adapt, and I think the deck is shared with the attendees. you have to take a look at these non-costly options in determining now the health condition of your employee, and be able to immediately identify whether that employee needs to get a fit to work clearance, or they're simply safe, then you do not need them to get any clearance at all. Next slide. You would see that you can segment the workforce according to the risk versus the need to be on site. So when you do the illustration of work segmenting, you would see that if the employee on the upper quadrant, if you would see that if you have an employee who is over 60 and has comorbidity, so let them work from home. Now, on the middle, if you have employees aged 50 to 60 without comorbidity, let them work from home or give them flexibility. It's only if really needed, let them work on site. Now, for the low part, if you have employees who age less than 50 years old without any comorbidity, then probably these employees need to work on site or provide them some flexibility. But if they're not quite needed, then let them work from home. Next slide, please. Now, this is a potential policy to reduce transmission. So it basically is listed from the less expensive going towards the most expensive. Now, if you take a look at the least expensive, of course, self-protection is less expensive, at least for now, going towards tracing and testing, which is now the most expensive. So you really just need to find out in the hierarchy of the policies that you can implement. You start with something that will not cost you. And later on, as you progress, now provide now for testing, especially for those with symptoms, just to be able to verify that. Next slide, please. Now, let me share with you that in Point West, what we did is we're confronted with the same problem. In a few weeks back, we were preparing to return back to office, and we have considered the showing of the proof, which basically a medical certificate and a test. So what we did is we tried to find out other options. Next slide, please. So in looking at the other options, we have basically created an application, which consists of several platforms. We created Health Pass, which basically is an employee health portal, electronic health records with telemedicine and a mobile app. So if you take a look at the workflow, it's really a solution that allows the company clinic manned by a nurse and the doctor to have a system that will allow them to monitor. So since we have an office clinic with a doctor and a nurse, we say, let's try to give them that tool and see how it will work. Next slide, please. So given that, what we did basically is we use the tool, allow our employees to use it, and we're able to do the monitoring and tracking. And what's also good is that each and every employee, they were able to create their own employee health portal. So this is their own web portal accessed by them, but different clinical data are being shared to the doctor, and the doctor are also providing them with advices on those pertinent symptoms. So there's a self-inputting of the questionnaire. There's a periodic assessment, which we do via telemed, so that we will be able to cover not just the small number of employees who are working in the offices, but also even those that are working from the home. And what they do is that they receive alerts whenever there are flags, red flags, or notifications that the doctors receive because of the symptoms that they are putting in the survey questionnaire. And then the doctor would now create a session with them, telling them, you need to go on a telemed session with me because I need to verify your answers to the questionnaire. And then if the employee is given a green light, those symptoms are not COVID-related, then the doctor will be able to issue them a medical certificate issued electronically. And then the reports are also given to the admin or the HR so that they have a copy of the health condition of the employees. Next slide, please. So if you take a look at the process flow, basically on the bottom, we have an employee who answers surveys on a daily basis. And then these are being lodged into the system. The nurse gets alerted if there are some um, values there that are off, and then immediately the doctor would also get notifications and alerts, and they are being scheduled for an immediate telehealth consultation with the doctor accessing their own EMR records, inputting now um, the consultation documentation. And then if they are okay, they're also given, the system also provides the ability to issue, of course, prescription, referral, lab request if they need to go on a procedure. And then what is also good is that aside from the medical certificates that they can be issued electronically, there's also that clinical summary of that consultation also shared to the employee so that they will have a copy as well. So if you take a look at the process, this basically illustrates the whole process where we have the criteria. On the next slide, what we did is we followed the scoring recommended by the PSMID, which is the Philippine Society of Microbiology. We incorporated this in the system so that there would be a scoring, 0 for zero symptoms, which is green color, 1 for orange, 2 or more scores, you get a red, which is basically a health alert. And we also added the color gray. These are for employees who have not been complying. So what we did is to ask the HR to be able to warn them that they should be inputting their data. On the next slide, you would see that these basically are the parameters that we use. So temperature, if you are above the normal, you get 1 score. If you are 0, then you're okay. Sore throat, body pain, headaches, all get a grade of 1. And the system has that scoring inside where this basically computes for your score and give you now a score at the end. Next slide, please. And of course, we also added some questionnaire that's related also if you have been previously diagnosed, if you have traveled, if you have exposure, or even if you are vulnerable. So this configuration of the scoring parameters works for us. And in the last slide, I would say that what's good about the system using the health pass process flow, the doctor, the nurse, the admin, while the employees are working in the office premises and some are working remotely, we're able to monitor based on the scores that are gathered from the system. Our dashboard will lit whenever we find out that there are employees with a score of 1 and 2. And we immediately encourage them to get a consultation with the doctor and grade them properly. So there are other options available for the people. I think even companies like the company of Vince, they're able to do their own COVID app that allows them to monitor their employees. But aside from the health condition, you can also do contact tracing in the system. We have added a feature where you can scan your co-employees so that if they have some symptoms, you'll be able to get their information and display the health column. So I believe that that basically summarizes the different strategies that companies can adapt in order to cope up with the COVID. But what is important right now is to allow, of course, our healthcare workers to feel safe, because we cannot force them to go back to the offices if they're still not feeling comfortable. But in the end, as mentioned by Vince, we need to take care of our workers because they take care of our business. So I hope that by the presentation, I was able to impart to you certain information. Anyway, these slides are shared with you. If you have questions, I'll be glad to answer them in the end. Thank you.
Okay, so thank you very much, JL. Ang galing, no? So it's a compressed presentation of what companies need to do, as well as they presented what they did in Point West as what was their experience, and hope we could learn out of that experience. So next, we still have one more speaker who will talk about AI and I think AI and analytics, perhaps on as applied to COVID. Now, so let me just introduce our speaker. Okay, our speaker is okay. Our speaker is the head of artificial intelligence capability at Point West Innovations Corporation. His name is Mac Aidinan. He heads the artificial intelligence capability for Point West, and is spearheading the development of Point West's various AI platforms and services that use cutting-edge artificial intelligence technologies with the goal of solving the most pressing problems of businesses across industries. So without further ado, Mr. Mac Aidinan.
Hi guys, good afternoon everyone. Can you hear me clearly?
Yes, I can hear you. Yeah.
Okay, thank you. So we can move to the next slide. My presentation will be, I will just be, my presentation will be quick because I'll just be adding some additional items to what JL already mentioned. So in the same way that AI, the role of AI has risen in the past several years due to advancements in the computational powers of our machines, its role in fighting the COVID pandemic is also starting to become more and more significant. So I will be sharing just a few examples of how AI is being used to fight COVID-19 around the world. And then I will zoom in on how we in Point West solve some of the problems of our clients using AI and some of the challenges that we face in our implementations. So one example would be, for example, in Pasig City, they use smart CCTVs, so-called smart CCTVs that have human detection AI engines inside. So their CCTVs count the number of humans detected in certain regions. So their visualization for this is like as shown on the screen, where in different regions, depending on the number of humans detected on that region, the color representation of that region is becomes more red or more green. So this makes it easier for the people who monitor the crowd to determine which areas need the most attention at different times of the day. Okay, next. So in France, they also use AI engines, they also augment their CCTVs with AI engines. For example, in the Paris metro system, they use security cameras that have object detection capabilities to detect what people are wearing. So this was used to measure, to detect the number of people that aren't wearing face masks or any of the prescribed PPEs. So actually, they mentioned that the purpose is not really to catch the people who aren't wearing masks, but to measure how effective their measures are, because they mandate that people should not be allowed inside without having to wear masks. Okay. And another example would be in China, where they actually use AI to automate the diagnosis for COVID-19 in certain hospitals. So in this case, actually, they're able to identify, the AI engines are able to identify and diagnose COVID-19 with 96% accuracy compared to doctor's diagnosis. And it's able to differentiate even COVID-19 from other ordinary pneumonia cases. Okay, so I'll move on to the experience of Point West in implementing solutions that use AI to fight COVID-19. So one of the most common use cases that that's starting to need AI implementations is in customer onboarding. So the typical process for customer onboarding is that customers fill out application forms and then they submit supporting documents as well as the filled out application form to an employee, and the employee validates the eligibility of that applicant and then processes the application if the applicant is eligible. So the problem with this, of course, is it's filled with uh, points of contact. So processes that need human to human contact. So once you fill up the application form, you already use your hands. And then when you submit it to a person, you're putting that person who receives the document at risk. So what we can do here actually is, next slide. So we can automate this to make the process contactless. So for example, instead of having to fill out an application form by paper, we can do the filling out online via online forms. And then the applicant can also upload the supporting documents required. For example, he or she can take a picture of the government IDs or the proof of billing to that system. And then once the customer submits it, actually there can already be an AI engine that can do the validation of the eligibility of the applicant as well as the processing of the application. And this can be augmented further with what we call robotic automation. So for example, the AI engine can do the tasks that would typically require human cognition or human intelligence, such as validating if the identity of the person is the same as that on the ID. And then the software robot can do the encoding on the different systems of the different companies. So for example, the AI engine, to be specific, can perform several tasks. Next slide. So for example, the AI engine can already do the document identification if the customer already submitted an ID versus a proof of billing, or if there's a lacking document to be submitted. There can also be a quality assessment if the customer submitted a document that is of considerably good quality. And then there can also be authenticity assessment. So if the applicant submitted a fake ID, for example, and then there could also be identity verification. So comparing the images of the person with the ID submitted. And related to that would be liveness checking, because we need to make sure that it is the applicant. Actually, the applicant owns the IDs. So this can include making the applicant take a selfie, and then the AI will ask for different actions to be performed to make sure that it is actually the person in front of the camera. And then we can also automate the data extraction. So for example, from a government ID, the AI engine can automatically extract which part is the name, which is the address, which is the age, etc. And then data validation. So given two different documents, you can already compare the values. For example, is the address on the proof of billing the same as the address on the application form? Okay, so next slide. So another common use case from our customers is another common ask during this time is the use of smart chatbots. So because people can no longer, it's no longer advisable for people to go to the different stores to make their complaints or to inquire about the different products. It becomes more feasible or more uh, mm, um, it becomes a better option to have chatbots. And instead of assigning people, full-time employees, to answer the different queries of customers, smart chatbots can actually do that for them. So smart chatbots can actually understand complex and conversational phrases and sentence structures. So it can actually even understand Tagalog, English, Taglish. So it feels more human-like and leads to a better customer experience. So as opposed to assigning humans to do the answering of the questions 24 for 9 to 6, smart chatbots can do that 24/7, and humans will get tired of having to answer the same questions over and over again if they are asking about the different policies, the statuses of different applications, or the same complaints over and over again. Uh, we can actually give that job instead to AI engines who won't mind the repetitive nature of that job. And at the same time, there is a quick response time. So just to share quickly, this is one of the use cases that we had for one of our clients. So they gave the task of handling complaints and looking at leads to the AI engine. So from the different social media sites, the chatbot scraped for the different posts and comments and replies of the different users to see which ones are complaining about their product and which ones are potential leads. So for example, if someone is asking for a product, for a specific product, the AI engine will detect that and answer immediately. So it can reply with a correct website where the user can see more information. And then the RPA will be the one to encode the results to some ticketing system. Okay, so I will move on to the most common challenges that we have faced in our implementation of AI solutions. Okay, the first one would be quality checking. So AI perform tasks, as I mentioned, that would typically require human intelligence. So just like humans that aren't 100% accurate all the time, so are AI engines. So if an AI engine is always 100% accurate, it's not AI. It's maybe just a simple program. So with AI, there's always some degree of inaccuracy, even if it's just 0.1%. there's still room for inaccuracy. So there still has to be quality checking as part of the process. And what we try to do is to make it easier for our clients or for the different companies to to check the quality of the AI engine. Okay, another common challenge is the availability of data. At this time, the state-of-the-art approach towards achieving artificial intelligence is what we call machine learning, and this relies heavily on data. So we have to the AI engine gets better and better at performing its tasks as it encounters or as it consumes more data. So we have to ask for data from the different companies before we can implement AI solutions using machine learning. And another common concern, next slide, of different kinds would be security and data privacy because AI uses powerful machines and the typical implementations use cloud computing already. So commonly, the companies would be concerned about sending information to the cloud, data privacy, the privacy of their data when they get to the cloud. So these are some of the things that have to be addressed. So for example, before anything gets sent to the cloud, there has to be secure encryption, with encryption of the information, and it only gets decrypted once it reaches the destination server in the cloud. And then also the storage of the information should be limited. So for example, in most of our solutions, the information sent to the cloud should be deleted after it gets processed. And the storage should be in the premises of the companies also. So the my point here is that AI is often seen to be something that threatens humans. So it can be threatening, it can go rogue. But actually, in this time, we are able to see that artificial intelligence is actually here to help humans, especially in this time of the pandemic. So thank you. That ends my presentation.
Okay, thank you very much, Mac. So there you have it, ladies and gentlemen. We have had two presentations coming from JL and Mac. And I would encourage that if you have questions, you can type them in our chat box. Now, the next part of our session would be I would get reactions from two of our guest panelists. So please allow me to introduce to you our two guest panelists. I'll introduce them one by one, and then I'll get some reaction from them, okay, one by one as well. So first, let me introduce to you one of our panelists, Mr. Michael Kelly Chu Lim, is the Vice President for Business Development at Mega Fishing Corporation. Is also involved with a lot of organizations. Is the past president of Southern Philippines Fishing Association, he's the president of the Zamboanga ICT Council, past board of director for Industrial Group of Zamboanga. He's the board of director for the Regional Technical Education Skills Development Committee, TESDA Region 9. He's the president of Industry Tripartite Committee of DOLE of Region 9 as well, and the president of the National ICT Confederation of the Philippines. Ladies and gentlemen, Mr. Michael Kelly P. Chu Lim. Hey. Hello. Sound check muna tayo, Mike. Sound check. Say hi.
Hi, Vincent. Can you hear me?
Yes, we can.
Can you hear me? Okay.
Yeah, sure.
Thank you for the introduction.
So before I get your reaction, I'll just introduce the other panelists first, and then I'll go back to
Sure.
you. So get back to you.
Okay.
Okay. Sound check is good. Now we have another panelist. We have Mr. June Saa. He is the managing director of Cebu IT BPM organization. He joined CEDFIT in January 2010 as the executive director, and after successfully turning around CEDFIT in 2012, he was promoted as the managing director of the said organization. In 2017, he helped transform CEDFIT into CIBO, Cebu IT BPM organization, the full-time outsourcing industry association of Cebu. In 2018, CIBO transferred it to its permanent office in Cebu IT Park, and he also saw the growth of Cebu's industry from less than 50,000 to more than 170,000. He helped inspire the Philippine countryside, develop their own IT BPM industry, and now it's up to 300,000 jobs outside of Metro Manila. because of Cebu's success in building a very successful IT BPM industry. Well, he was also the past president of NICP in 2016, which was originally called SEDFIT and now CBIL. Ladies and gentlemen, Mr. June Saa. Hello, June. Sound check.
Hi, good afternoon, Vincent.
Yeah, if you can turn on your camera, that would be great.
Oh, sorry.
So we can see you. Yeah. There you are.
Yeah. So thank you for inviting me to this webinar.
Okay. Okay, so here's how we'll go through this. I will get your reaction on the two presentations, but not only that, also the situationer, perhaps for about 3 to 5 minutes, the situationer in your respective areas. It's a good thing that we have representatives from the Visayas and the Mindanao region that we can share much more information so that you would know what's happening all over the country. So let me start with Mike.
Okay, thank you, Vincent. May I start with, I guess, the situationer first, if you don't mind. NICT has a partnership now with DICT, wherein they recently announced 25 digital cities, and these cities are meant so that we can start moving some of the BPO work to the countryside. It's part of Balik Provincia. But if you look at the situation, I think the industry has to restudy the concept of mega sites, where what BPOs used to do before. They have 5,000, 10,000 people in a mega site. And we just found out that it only takes a certain small virus to break that all apart. And we've seen more and more BPO companies coming out with microsites now. And microsites are now, in a way, their BCP, business continuity plan, so that if something does happen, you have 5, 6, or 7 other sites that will take the slack of one site. Imagine if you only have 2 sites and COVID hits one of them. How can you quickly shift 5,000 employees to your other site? It may not be as feasible as we thought, because post-COVID, that will no longer be the case. So what NICT has been doing is we work with the industry, we work with DICT in identifying certain cities that are capable of absorbing these people, both talent-wise and infrastructure-wise. And we help the LGU work with the industry so that we can set up some kind of microsite there with less of a hassle, and they can be up and running hopefully in a month's time or less, which we've seen happen. And usually that is done through NICT collaboration. So if there are any members that you have that are keen on expanding to the countryside, I think we are represented in 83 cities around the Philippines and hopefully expanding more. So if you guys have any interest in certain cities, please reach out to us. Sir Jun is also a past president, so he was keen. He was key to making what NICT now what we are now, and we hope to be part of this organization because we are all about bringing jobs to the countryside, and your sector is all about job creation. So thank you for giving me that time. Now, in terms of my reaction, my concern with health and safety in the COVID situation is, how do we balance safety and efficiency? I mean, in any business, that is the key. Actually, I was surprised that I saw that your industry was able to achieve 83%, 75% efficiency from 50% before. And we should be proud that we were able to achieve that. I happen to come from an manufacturing industry wherein social distancing has dropped our efficiency from 100, or actually 95, to now 50, 55. And I know that will impact a lot of business, because who can work with 55% efficiency in the long term? Maybe we can do it for 1 month, 2 months, 3 months, but it's looking like this will be the new normal for the next few months. So the key there is, how can we balance that efficiency with safety? We do not want any infections to happen, but I guess even I had a question in my mind, no matter how strict we are with all the with all the programs we have in place, can we really assure ourselves that we can be 100% COVID free, even though we go through all the things that have been listed before? So that is really what I wanted to find out, because we don't want a reoccurrence from happening, the so-called second wave. So we hope to be able to try our best to avoid any infections, but hopefully somebody can come up with an ingenious way to say that we will avoid it 100%. I think that's really what I wanted to hear. And Max actually said that maybe AI is that tool or solution for that. Actually, I'd like to hear him speak more about document authentication and facial recognition, because that was actually hard for me to understand. Not hard to understand, but interesting enough that I'd like to know how they use AI to do that.
Yeah. Okay. Thank you, Mike. So that was quite insightful. The balance between safety and efficiency. That's the balance is what we're looking for, actually. So now let me go on with June. Hi, June.
Yes. Hi, Vincent. So yeah, we'd like first to thank both our speakers, JL and Mac, for sharing their insights. And of course, these were very specific practices that's been happening inside Point West. And I would say the presentation of JL was very useful, and this can be, in fact, used by different companies, and more or less how to spot whether our employees are already being infected by COVID. So I think that was a very good, some kind of a checklist, but there's something I'd like to suggest, that in the scoring system, probably they should be able to develop to determine who should be staying at home and who should be going to the hospital. Because I don't think everybody needs to go to the hospital. And that is one of the biggest problem right now. Our hospitals are being overwhelmed. And I can perfectly understand our frontliners that every cases is being dumped in the hospital, when a lot of this can be done. You can do it, you can do the probably isolation at home and be well yourself, no? And avoid enriching the virus, because in the hospital you can expect a lot of enrichment there with all kinds of viruses coming in and out of the hospital. So I'd like to add that point, that some should just stay at home and just isolate themselves and just be extra careful. And of course, to those who are not infected, then it's a matter of discipline. We should just need to wear a mask, do regular sanitation, and other matters as well. And on the point of Mac, I think artificial intelligence would be a good intervention, because it will mean that people need not do things themselves, so that they can prevent being exposed to the virus. No? So this is indeed one way of preventing the spread of the pandemic. But one thing that we should all be thankful COVID has brought to us is that our society has expedited its adoption of technology. And I think nobody can deny that. Because I realized that it was during the start of COVID when we had our first virtual meeting. So we were spared by the traffic and we were spared by the virus.
Mm-hmm.
And of course, you'll notice now that there's so much activity on online food ordering. And well, it's good for both. You get your food and you stay at home, you don't get the virus. And of course, there's a lot of online shopping and even online payments, no? And online banking activities going on. And we can also say that even telemedicine is becoming very popular right now. You don't have to go to the doctor. You can just consult online or use whatever media to avoid going to clinics. No? And of course, we have more work from home right now. And we're thankful for PESA for allowing us even as much as 90% of work being done at home. And currently, we're seeing even our education system is adapting it. No, we see a lot of online classes going on, and even our public schools are adapting that. So we should be thankful that COVID came. Otherwise, it will take longer for us to adopt technology. So I think that's far as what I can share with this webinar.
Okay, thank you very much, June. That was very insightful. Ano? Even if you are infected, you can be healed at home. That's I think that's one thing that most of us should be bearing in mind, so that so as not to congest all hospitals. Now, I will circle back to you guys, but there are some questions which we actually received when some people registered. So I'd like to go through some of the questions. But for those questions that we cannot answer due to lack of time or in the interest of time, we will be giving them to the speakers, and we will be asking for the replies on these questions, and we'll send them to those who asked the questions. So let me first read one of the questions. What is the protocol if an employee who entered the company premises is found to be COVID positive? I'm not sure if JL can take on that question, but maybe from an experience point of view, or a planning point of view, a BCP point of view, what could be the other than the protocols from the government, what else could companies do?
Yeah, thank you for the question, Vince. Well, I think each company, especially in the HR, should be able by now drafted their own company protocol as far as COVID is concerned. There should be a defined protocol on testing, disinfection procedures, isolation procedures, social distancing, placement of signs, etc. I think we have a DOH memorandum and even a circular coming from the DOLE about this. For the DOH, it's Order 2020-0220, dated May 11, 2020, which as early as that time, they already identified the protocol, especially on the reporting side.
Okay. So recording as well as the detection, and well, each company will have their own programs on top of what the government says. May I ask like Mike or June, perhaps in the countryside, what would be the things that you guys are thinking of putting in place so as to address, for example, cases like this happen. There's an actually infected person who enters the premises. What should be the actions to be taken?
Surgeon might want to go first.
Okay. I think we're just following what are the protocols of DOH as well. So the companies here in Cebu are just following what these guidelines are.
Oh, okay. For us, we actually had a similar incident. Thankfully, it was a false negative. We had somebody from Taiwan who came here to work on our plant. He got sick, so we reported him right away to the LGU, and the LGU came in with some doctors. We isolated him. We did not do contact tracing yet because we actually waited for confirmation. But thankfully, it was negative. But if it was found to be positive, then contact tracing would have followed, and then calling each one of them, and hopefully each one of the ones that are exposed would have to be quarantined, self-quarantined at home. So that was the practice that we had in place, and thankfully, again, we haven't had the need to activate that.
Okay, thank you. Siguro at this point in time, I'd like to dig deeper into the point of Sir June a while ago, saying that the scoring system, what JL pointed out in terms of their scoring system on how to say that this person should be at home or this person should go to the hospital. JL, what do you think could be some of the practices in terms of this scoring methodologies And in terms of your application, in terms of the app that you have developed or your experience in Point West, could you give some of your reaction to that?
Yeah, Vince, thank you for that. Well, basically, let me start by mentioning that the scoring system we have adapted is the PFMID recommended scoring. So instead of inventing something, we also have a doctor from Point West who have validated that the scoring should be based on the known process of diagnosis, which is the presence and absence of symptoms in order for you to define the disease. So under that premise, I think what's good about the system is that for every values that you put, which is off, meaning if you enter there, I have not been exposed, but you have entered, I have been exposed, or you have symptoms, let's say I have a headache, or you have entered a temperature that is above 37.6 6 degrees Celsius. So any of those answers that are off, it immediately gives you a score. Can be 1, 2, 3. Then that automatically triggers the report in the dashboard telling the nurse to double check. It can be a mistake from the side.
Hello,
I think
hello.
we lost him.
Hello, I think we lost JL. So I think to supplement his point, I think the scoring system is good. It's a good practice. Of course, having an app is a good thing, but having the scoring itself as a process within a company, I think would be great. So go ahead, JL. You can
Just
continue. Go ahead.
by saying that when we have rolled this out in Point West, immediately, at least 3 or 4 days after the employees started putting in, I think our doctor immediately had several telemedicine consultations because they needs to verify whether that is really the symptoms of the employee. So imagine at the onset of the symptoms, you are immediately consulting a physician who can clinically say or assess whether you have the presence of a symptom. And if in case you have, the first advice is do not go to work. You need to be validated more, especially if the symptom is recurring. You need to find out without contact to your family members or even in the office. We'll see if the symptoms die down. Now, if it dies down, then at least you have now the whole process again of inputting the answers to the questions until you go now to the score that is clear or a green color.
Okay. Did I get it properly that it started because your company adapted the need to really show proof before you can go back to office?
Well, that's one. But basically, it's a tool that the company can use, especially those who have in-house clinics. If you have paper drop records documents, and if you do a Google Sheet survey, it would take time for you to be able to assess or be notified if there are symptoms present. But the system gives you notification. There's a code that we can run that automatically gives you now a red color for anybody that has problems. So if you are manning, let's say 600 employees, it would be very difficult using a Google Sheet. That's why it's something that can notify you.
Okay, that's good as a system. Now let me throw this one to Mac. To Mike's point a while ago of safety and efficiency, the balance of safety and efficiency. How do you think AI could be of help in that in making it happen?
Okay, so to answer that question, I will be citing a specific example. So in one of our clients, as I mentioned, customer onboarding is a common process where AI can help actually. So in one of our clients, in their customer onboarding process, they ask their applicants to submit two things: a valid government ID and proof of billing. So the first thing that they do, the employees, would be to check if the documents submitted are complete. So I think that's two valid government IDs and one proof of billing, where the government ID should have a signature. So the AI can already do those things. So check the completeness, the presence of signature, and the presence of proof of billing. And then the extraction of the information, the AI can also do that. So it can automatically extract the different fields from all the different documents submitted. And then the comparison of the values for each of the, because the information should be the same across all the documents submitted, and also the authenticity of the person. So should be able to make sure that it is the person who owns the documents that he or she submitted. And another complication that we found that might be common across different industries is the comparison of addresses, because the applicant usually types in his or her address on the form and then submits a proof of billing. But the comparison becomes difficult because there are different ways to spell or to shorthand the address. So for example, the street versus the street. So it's hard to automate the comparison. So we also make use of an automatic address formatter. So to standardize the different ways of writing the address before we are able to compare those with exact match. All those things the AI can do, and then what the output will be forwarded to a software robot, what you call software robot, because the next step for that company would be to input all the results of the assessment to a system. So the robot will be the one to type in the assessment to their system. So in that way, because all the earlier clients now move to online applications before they make use of paper-based
Mhm.
applications. So now we have to move everyone online.
So you can
So the AI,
practice, yeah, you can practice social distancing by using such kind of system, and then you still get the same result.
that's true. And one thing to note is that their full-time employees now are being used for, they help out with quality checking, because as I mentioned, AI is never 100% accurate.
Okay.
So the full-time employees are the ones who review the output of the AI, but they can do that online already.
Okay. Let me now ask another question to both Mike and Sir Jun. This is as at the industry organization level, or at NICP, for example. What would be the advice that you're giving, especially to those to the member organization, in terms of how they could transition from the current scenario going to the new normal? Are there certain guidelines or the key points that you are advocating as at the industry association level, or something to that effect? Let me start with Mike first.
Okay. I did touch on that a bit a while ago. I think a restudy on mega sites should be done. I know that it was done really because of efficiency.
Mm-hmm.
And of course, having everything in one place makes sense for a company. But knowing what we know now post COVID, it may not be as feasible now as before, or one mega site will not make you will not make your business continuity plan effective. So we hope that the industry can look at creating microsites, if not mega sites, but sites, multiple sites within the countryside, wherein if anything happens, God forbid, in a certain area, other areas will not be as affected. In that same way, their full operation may not be totally affected, unlike what just happened to us now. So that's something that we would recommend that the industry could look at. And in our own way, we are empowering our own ICT councils to ensure that the LGUs are ready, their city is ready, both connectivity wise, infrastructure wise. And that is really what we're doing in preparation for the Digital Cities program of the ICT.
Okay, thank you, Mike. How about Sir June?
Yeah, I fully share Mike's suggestion to have those smaller sites rather operating in the countryside, because in this case, we will also be bringing more opportunities to the countryside. No? And of course, if you only maintain one mega site, then if such an epidemic will hit you, then you don't have any other choice. But um, you'll be forced to consider options for business continuity.
Mm-hmm.
So there's this logic in putting your eggs in two different baskets.
Okay, yeah, very well said. Putting your eggs in several baskets so as not to break them all. Okay, so I have another question here, and I guess I'll throw this again to JL. Uh, this one, the exact question is, what are the processes covered with respect to test administration and quarantine management? But I'd like to twist it a bit in terms of managing, coming back to the offices. The question you had on to test or not to test. What would be your advice based on the experience of Point West and with respect to the technology that you are promoting right now?
Okay. So for the algorithm that we have or the scoring parameters, anybody who has a score of 2 and above needs to be verified by the doctor. And it's the doctor's clinical advice for him to be able to say that a test is needed. So we always defer to the doctor. That's why what we did is just a platform to allow the doctor to work with data that will provide him the ability to gauge the health condition of the employee. So it's the call of the doctor whether a test is needed. But what we present to him is a scoring that allows him to simplify. Gauging now from among 600 employees, you have 2 or 3 people who has the symptoms with a score of 2 and above. Then that basically is. And I think what Roger mentioned here, we also have guidelines from DOH that basically tells you whether somebody who has several of the symptoms really need to go to the ER and get themselves checked up.
Okay, very well said. Thank you. It was a good answer from JL. Now, okay, let me circle back to Mac. No? So Mac is still there, right? So I'd like to ask a question regarding the data privacy and AI, because in AI you analyze a lot of data. So how do you balance the data privacy and the AI implementation? Do you have any insights on that one?
Okay, so thank you for that question. Actually, that's a very common question from our clients because they're concerned about their data, and especially with AI, we have to make use of their data, to train the AI to perform the tasks. So one of the most critical part would be for us to be able to protect the personally identifiable information from the data that we collect. So one of the measures for that would be to ensure several layers of encryption and decryption. So that means once the information leaves their system, the information has to be, even if someone hacks into the system or intercepts the travel of the data from one server to another, they won't be able to make sense of that data because it's encrypted with several layers of encryption algorithm. And then once it reaches the server, that's where it gets decrypted. So only the server will have the tools to understand that information. And then the processing of the data will happen at the server. And then, as I mentioned, the storage, if the information has to be stored because that's a requirement of the client on the cloud, the information also has to be encrypted so that anyone who will look at the data won't understand that data. But the common practice usually is after it gets processed on the servers, on our servers, it gets deleted.
Okay.
It gets sent back to their servers, and that's where it gets stored. So it's only a pass through our server.
Okay. Okay. Thank you very much for that. Now, actually, we still have a couple of questions, but in the interest of time, actually, I'd like to ask our two guest panelists to give us just 1 minute, perhaps, of sort of a summary or a conclusion as to on their side what they can say about today's presentation, the key takeaways, and what they want to somehow advise our audience on with respect to their industry organizations and how we should move forward in the new normal. May I ask Sir June first?
Well, yes. Well, COVID is here to stay, and as of now, we don't have any what do you call that, vaccine, so to prevent being contaminated with COVID. So I would say that everybody should be more responsible, wearing a mask, of course, proper hygiene, social distancing as your first line protection. It is our responsibility to take care of our health, And so we should take care of our health, and we should do things to help in the spread of this disease. And COVID is not a death sentence also. Not everybody dies of COVID. And statistics shows that only a very small percentage of people die because of COVID. And these are compromised persons, usually older people, and if you have health issues otherwise also. And it complicates COVID. So you can survive. You will not die if you take care of yourself. So let's do that. We can fight this thing. And well, as I've said earlier, the very good thing that COVID has brought us is that we have expedited adoption of technology, and technology is here to stay. So thanks to technology, well, thanks to COVID too.
Okay, thank you very much.
Thank you.
Thank you. Thank you very much. Let's now hear from Mike.
I guess from the presentation I saw, I admire HIMAP and its members. I was actually surprised that your members were able to achieve 85% efficiency, even though most of the people were work from home or we were under ECQ. Like I said, being in the manufacturing industry, it's not as easy to do. So I admire you for doing that. And the steps that you are taking to prevent infection is something to be admired and copied. What I do hope, similar to what Sir Jun said, is hopefully we don't get any further infections. And I pray for everyone's safety. So thank you.
Okay, thank you very much. So, ladies and gentlemen, we would like to thank our speakers, JL Butor, Mac Aidinan, and also our guest panelists, Mr. Michael Lim and Mr. Jun Saa. A virtual round of applause for those guys. Thank you, guys. And this formally ends our session. But before we formally end, I'd like to call on one of our board of trustees and the co-founder of Genfinity, Mr. Jeff Williams, to give us the closing remarks.
Hi, thank you for that. Hopefully you can hear me okay. Once again, just another wonderful session. I think we really truly are bringing some value to the membership. Hopefully you guys all took something very good away from that. I was making notes for my typical summaries or synopsis. I don't know if I need to go through that, but just real quick, I want to shout out a big thank you to Roger and the secretary for putting this event together. Gail for her nice welcome statement for bringing us in. Vince, you did an excellent job of moderating, keeping everybody on track. And kind of led us into how we're going into the new normal and how we're going to deal with it and how we protect our most valuable asset, which is our people. And I think we always need to keep that in mind. JL had a great presentation on just kind of showing us how well the industry has reacted to this, worldwide pandemic, which is certainly unprecedented. I think we really have stepped up really well, and a lot of government help has been there for us to make that happen. So we appreciate that. Very interesting on the return to office requirements, or the checklist that you say per se you put together. Really like to see how that works out. And I do want to point out a little bit of ageism on your slide when you were kind of talking about the people coming to work. I noticed it was 60 over and then 50 to 60. I think the ironic thing is a big chunk of our workforce is probably 30 and below, but I don't know why you're picking on me particularly, I guess. But and then the other, again, talking about health passes, the health pass software that Point West has designed and put out. These are exactly the kind of tools we need to see, and I'm loving to see these things coming from the Philippines, not just something else that's kind of come in from some other vendor. It's nice to see these things being grown here in the Philippines and adopted to work in our environment. Mac had an excellent presentation on artificial intelligence and how it can be applied and affected with the COVID-19 pandemic. And then our two panelists kind of representing the provincial areas, both June, I mean, he's an institution, I think, when it kind of comes to talk about provincials. He's always been the name that I've always heard for forever, and I know you personally, and thank you for spending the time with us. I think you made some very valid points that self-isolation, the hospitals are very busy right now. So, you don't necessarily, if you don't really have to be there, don't go there, because a lot of things you can take care of yourself. It certainly is not a death sentence. It's just taking care and keep in mind and following the rules and things that we're talking about from how you keep yourself safe with face masks and social distance and whatnot. And Michael Lim, again, I know you're taking a very active role now and heading up on the with the SEDFIT and the not SEDFIT, I'm sorry, but with the NICP. And how do we capitalize on the just the microsite nature of provincials? I think is an excellent segue into the nature of the way they are, the smaller sites. Having those is there's a natural BCP process to that. They're certainly they're remote, they're smaller, and a company set up with maybe 10 small locations has got a lot less of an impact than one person or one company that has everybody all in one site. Which obviously, if a site gets shut down because of some infection issues, you got a much bigger problem. We covered a lot of good questions in the session today too. I won't go over those in detail. You guys heard what they all were, hopefully. But again, a very excellent session. Thank you all for all of you attended to it. I do have one thing that I would like to add this with or end this on. And I want to say, Roger, Bang, a whole bot, can we create a HIMAP member challenge? I mean, I think we need your help in determining what the prize would be. Either that or I guess maybe we turn it into a drinking game. And where I'm going with is combat the new normal, okay? I've heard it so many times. We opened up with the new normal. We hear the new normal on everything. I think it was said about 5 times in our presentation today. And the only reason I'm taking issue with it was, if you guys remember a year ago today, everybody was talking about disruption. And disruption was about how are we breaking the normal. So now we've kind of done an about face, so now I'll talk about how do we adjust to the new normal. Maybe we're trying to be talking about ourselves and looking at this about how do we disrupt the new normal, right? And so I think it's an idea to look at and maybe kind of something we can throw out to the membership. If you guys can think of an interesting way to make a challenge, if we can coin a better phrase or a better tagline for that, I think that'd be really, really interesting. But anyway, very, very informative. Thank you all for all of your participation, and thanks again.
Thank you.
Okay,
Thank you,
thank
Jeff. Yeah.
Go ahead, Roger.
Go ahead, Vince. Yeah.
No, Roger, go ahead.
No, I just want to say thank you. We'll take up the challenge. We'll take a look and see what we can do. Our sessions got a lot of members more engaged, not only members, but even friends and colleagues. So they look forward to the Friday habit. So I just want to thank our speakers as well, JL, Mac, our panelists, Michael, June, and of course, Gail, Vince, and Jeff. Thank you all. Yeah. Vince. Yeah.
Thank you. Sige, I guess that's it. So this formally ends our session. See you again on our next session. Thank you very much. Bye-bye.
Thank you.
Thank you very much, everyone.
Thank you.
Congratulations, Vin. We did it exact time 2:30.
Thank you, Sir JL. Sir
Great
Mac.
job. Bye.
Bye.
Bye-bye. Thank you.
Okay. Bye-bye.
Talk to you soon.